M. Christian Dubé et du directeur national de santé publique, Dr Horacio Arruda. M. Legault, à vous la parole.
On va s'installer. Je commence tôt comme ça. Je vais prendre une gorgée d'eau. Bonjour tout le monde.
Welcome everyone. Well, listen, I am extremely happy to be at the Olympic Stadium. This will be one of our great vaccination centers, as you can see. And I am here to announce a great news, and something that's been waited for a long time. Next week, as soon as next week, the population in general will start being vaccinated. After a year, I feel extremely special to be here. And the CHSLDs and for the staff workers and so on. We'll start thinking about the population in general for our vaccination campaign after these groups of people. So we'll start vaccinating people who are 85 years old and over. We need to simplify things. We don't want to work with the precise date of birth. We'll work. Well, if you were born in 1936 or before, it means that you are part of the first cohort. You'll be vaccinated then, in that cohort. How do we proceed? Well, first of all, for us, obviously, you can imagine that there will be all sorts of people who want to be registered. But the easiest way to register is to do it from the internet, online. I understand that some people don't have a web, they don't use the internet. Well, then they can be helped by their child or by somebody that's close to them. And
Quebec.ca/vaccin COVID, vaccin sans S. COVID.
So again, .ca/vaccin COVID without an S, or you can dial 1-877-644-4545. 1-877-644-4545 is the number to dial. Starting this Thursday, you can start registering, dialing this, or going online. And so you need to have your health insurance card. You'll be asked to provide information. And when you come also for your vaccine, you need to show your health insurance card. And when you are vaccinated, you'll be confirmed for your second shot. Because I want to confirm this. I mean, if you don't know it, to be fully protected, you need 2 shots or 2 doses of the vaccine. So once you get your first dose, you'll be told about the date for your second shot. Now, it's very important to say, because we don't want to clog the whole site, overwhelm the phone lines. The people that are born after 1936, don't call. Don't go online, because now's not the time for you immediately. Things will be fast. It will be within the next weeks, but we start with the people who are 85 years of age and over, the people that were born in 1936 or before that. And we'll start with the Greater Montreal region, since the virus is more present in that region, in the Greater Montreal region. But, and this is important, I'd like to clarify things, everyone that was born in 1936 or before. No matter where you live in Quebec, you can register right now for your appointment. The health team members have made sure that there's room enough for you in all regions of Quebec. So we'll start in the next days. We'll start with Montreal, then we'll go to the other regions. But this Thursday, for everyone in Quebec, if you were born in 1936 or before 1936, if that's you, you can reserve your appointment for you to receive your first dose. And after that, we'll have 80, 70, 60 years of age, and so on, and for the population in general. That will be the sequence. Now, we want to go pretty fast. And Christian, usually you're on my right-hand side, so I mixed up a little bit. Maybe they do it on purpose, but Christian has called with Pierre Fitzgibbon, the economy minister. They've called different companies, and I want to thank them. We asked the businesses, mainly the big businesses, are you ready? Are you ready to accommodate for some vaccination in your facilities and so on? And we've had so much collaboration from the big businesses, so I was so impressed. This won't be for tomorrow morning, but I mean, when we come to that bridge and we need to cross it, I'll tell you about it. This is great news today, because when we vaccine people, we win. Vaccinating Quebecers means we will win against the pandemic. So this is great news for today. Quite some news. So we went through all the CHSLDs, and we have almost half of the RPAs, the senior homes. And so that's all done for the RPAs, and we have 200,000 employees that belong to the health network. This is done, so vaccination will be faster for other groups in our society. But hope is here. This is the great news. This is important. We must stress this. Hope is here. We at last see the light at the end of the tunnel. And we're not talking about a remote future. This is in a few weeks. In about a few weeks, all vulnerable people will be vaccinated. However, this is a big however. We have to be prudent within the coming weeks. So what's important is that for people that are vaccinated, it's going to take 3 weeks before the vaccine has its full impact, which means that the 3 upcoming weeks will remain critical. Now, something else, the other reason why we have extremely prudent, we have to be prudent because of the new variants. We'll tell you more about this later. Obviously, in Quebec, as is the case everywhere around the world, the number of new variants is increasing. And it's a variant that is more contagious. It's easier to catch it somehow. So this is an additional reason, and we have to be prudent because of that. Practically speaking, this means that if we're not careful, in the next weeks, we could see the number of cases booming. I'd like to call all Quebecers to consider this. I know that you're impatient, and I've received all sorts of messages, notably this weekend after last week's announcement. We've received a lot of messages. I'd like to remind you that next week is the spring break, semaine de relâche, so break. We wanted to do something special for families because of that. So cinemas will be open. I think that everybody will open them up except Mr. Gouzeau. We'll have ice rinks also. They'll be open. We'll have the arenas. They'll be open. And some people tell me, yeah, but this is not consistent. Why don't you open, let's say, theaters for kids? We could have done that. It's not more it's not riskier, you know, when you deal with theaters for kids. But when we talk to the owners, the theater owners, and these types of halls, they said we would have preferred to have a few extra weeks because, number one, we want to get some financial aid, some support for a few weeks. It's going to take us some time to get prepared. And to be honest, in many places, the shows are at night. So with a curfew at 8 p.m., it's not an ideal situation. So it's not an easy thing to be profitable then in such a context. That's why we chose theaters, cinemas, ice rinks, and so on. But we haven't included the show venues and theaters. It doesn't mean that it's more dangerous. It's the same thing with churches and faith-based venues. Same thing with sports. People said, why don't you add some tennis centers or gyms? Maybe in some places they could have done that, but it's a fine line, and it's hard to define. In gyms, you might have different people that are playing soccer, and then, well. And also, we wanted to proceed in a gradual fashion. Again, I want people to understand it's not because we've chosen the venues or places that have less risk. No, we wanted to connect with some families, especially for the spring break. But I want to encourage people, if things go well within the upcoming weeks, we'll be able to open eventually all the show venues and theaters and also the churches, faith-based centers and so on, and also for indoor sports facilities. We'll be able to do that, to open them up. But we'll wait and see what happens with the variant and also the variants, plural, and also we'll have to think about the spring break. La semaine de relâche, the spring break, it concerns us. I mean, we face a situation whereby it's a big test. Next week will be a big test. We hope not to see what happened during the Christmas time, the holidays. I understand that a lot of people will be on a short vacation or a holiday with the kids. And I know parents sometimes, they take some days off during the spring break. Now is not the time to do gatherings and to group together privately in some private residences, houses, in cottages and bigger hotel rooms. No, you have to follow the guidelines in terms of the family bubble and so on. After the weekend, we don't want to see a spike with contagion numbers. We are concerned. I must admit it. We are concerned, and we must ensure that we succeed. And I ask Quebecers to remain prudent. We do not want to face a third wave. Nobody wants that. And if people start gathering like they did during the holidays, well, that's what happened. So let's remain prudent. And I'm going to insist on what I've repeated a few times. It's really not a good idea for children to be taken care of by great parents. No babysitting done by great parents because they're at risk. That's dangerous. So I'd like to conclude, and I'd like to say thank you. In conclusion, thank you again. Thank you for all the efforts that you've shown, all the things you did for almost a year. And I understand that there are a few people that find that we are too prudent. Obviously, in Quebec, if we compare ourselves with others, in most cases, we were more prudent than elsewhere. But I'm convinced that because of that very prudence, we were able to save lives. Some lives, we have saved them because we were more prudent. That is quite something, and we must realize it. Now, I ask you for a last effort for the upcoming weeks. For the next weeks, please do not drop the ball. I count on you, and I want to express my big thank yous to all Quebecers.
We're announcing today that we'll start vaccinating the population next week. We'll start with people over 85. If you're over 85, you'll be able to make an appointment from this Thursday. This is a great news because vaccines are our best hope to win this battle. Vaccinating Quebec is beating the virus. We've already vaccinated in all the CHSLDs, and we're seeing the results. There are almost no more death in CHSLDs. We've also vaccinated almost half of the people living in senior homes, and we should have finished this week. So it means that we've vaccinated those residences, homes, and also nearly 200,000 health workers. So there's hope, but the battle is not over. It takes 3 weeks for the vaccine to have its full effect. We must remain careful in the next few weeks. There's also the risk of the variants that are more contagious. The numbers we see could change very quickly if we let our guard down. Next week is March break. I have to say that it worries us. We must avoid gatherings to avoid a third wave. In a few weeks, we'll have vaccinated vulnerable people. We must continue our efforts until then. I'm counting on you all. Thank you.
Merci, Monsieur le Premier ministre. On va débuter la période de questions.
Thank you, Mr. Premier. So we have a question session now with the journalists here and also virtually. Please raise your hand. We'll start with the questions from this room. Question from Le Devoir. Mr. Premier, good day. Is there a priority for the different cohorts, the different age groups for chronically ill people or patients with comorbidity? Yes. Answer, yes, there are people within a group and the people that have certain conditions which are more severe. But eventually, what will happen is we must understand that the quantity of vaccines won't be like what we have right now, not at all, which means we'll be able to proceed with different priority groups concurrently. Question. People who are 80 years of age and over, 70, 75 years of age and over, they'll be able to register when? Online or through the hotlines, phone lines? What about people from Montreal? COVID is more acute. It's more difficult for authorities in that region. Will they be vaccinated faster? What about people who are 70 years old and over in those regions? Will they get faster access to vaccine? Answer, we'll first of all make sure that the process is well done with people who are 85-year-old and over. If we eliminate all the things, the RPAs and the CHSLDs, 85 years old means 200,000 people. You know that we get 100,000 vaccines this week. And this will be true for the upcoming weeks. So if we can spread things out for the upcoming weeks, we should be have vaccinated people who are 85 years old and over within the next weeks. Again, we might get more vaccines than 200,000. We have press conferences every week, so updates. So we'll give you an update every week. We'll tell you where we are at with certain populations, and then we'll give you a forecast about how people can eventually get vaccinated. We'll have a beautiful example with people who are 85 years old and over. Do it over the internet because it's easier to go online, get some support, some help if you need to. But our experience for the upcoming weeks, the next 2 weeks, this will tell us what to do for the rest. Question? Mr. Dubé, do we have anything for the elderly who live alone and they have mobility issues? They might be poor, they might not have a phone, they might not have communication tools. Do you have a mechanism to help them, to reach them, and to provide some traveling for them? We're limited with the vaccine because of Pfizer, for example. We cannot move people around. We cannot do that with Pfizer for obvious reasons. So what we'll ask now is that for people who cannot go there, maybe some people will be helped by family members or people who support them. The principle is just to go there, to travel. If you cannot do that, we've asked Mr. Paré to work with community organizations. And again, I'm thinking about all the facilities, all the CEOs and so on are looking at how many people won't have registered for the first days. And with community organizations, we'll be able to work. We have a CEO, for example, for the east side of Montreal. And so we'll take into account how people will register. We'll get in touch with our community organizations that could support people. But the principle is that they must go to their appointment because unfortunately we cannot give them the vaccine at home for now. Maybe we'll be able to do that with AstraZeneca. It will be more mobile, but we have to work with Pfizer for now. Second question for you, Mr. Dubé, or for you, Mr. Arruda. We went beyond the 2-month period after the first doses for the first vaccines. And so when do you think you'll deploy the second dose? When will the second dose occur? Should it come from the same manufacturer? What's the point of view we have about new vaccines that might be around the corner? Only 2 have been approved for now. I'll answer this. We are within our delays. The second dose should happen within 90 days, that's for sure. Giving things, how they progress right now. Things are going well. The second dose will happen during the month of March, and so we'll follow our deadlines. And so a lot of people have confirmed, a lot of international organizations said that this was the right strategy to do because we're vaccinating more people. Now, regarding the two types of manufacturers, I'll give the floor to Dr. Arruda for the answer. Some clinic studies are conducted when we combine the doses, let's say one vaccine and a second dose with a different vaccine within the same category, ARN and ARN. We'll follow up on that, but we want to use the same type of vaccine for now for the doses until we get adequate data to show that we can actually alternate things between the doses. Question from Radio X. I don't know if you felt the same thing when you came here at the Olympic Stadium. I thought about L'Âge des Ténèbres, the movie from the director, Arcan. Anyway, people mention the age issue. People are organizing things. There's a big protest that will get organized in Quebec to mobilize people against sport. A lot of people are angry on social networks. Now, can you tell me exactly if you are doing some ageism or not? Are you doing some ageism? 80% of people who are hospitalized are 65 years old and more. And also, people who die are older. That's a fact. People who are older are more impacted. That's a fact. So we ask the youth to be in solidarity here. We tell them to avoid visiting their great-parents, to avoid contagion as a general rule. And then I wonder, I think, and I say, it's our elderly. They are the people who have built Quebec society, the Quebec that we see today. So that's the least we can do for them. We have to be working in solidarity throughout Quebec to protect our elderly population. Follow-up question. I work for a radio station from Quebec City. This is not a question about the inevitability of the Nordics coming back to the city. Mr. Legault said 7 times that you were not telling the truth regarding changes. I'm referring to the tramway file for Quebec City. It's like there is a clash, the clash of titans here. Do you think that Mr. Legault no longer wants to talk to Mr. Bonnardel? Do you think he's the right person in this discussion? There seems to be a clash. Answer. It's all the members of government that are convinced that about the structuring transportation project for Quebec City. This can be improved in order to better serve the suburbs of Quebec City. There's a tramway component, a bus/bus initiative for Quebec City. The first tramway component had to cost, $2 billion first, but the same route is costing $3.1 billion. We slashed things consequently, and we had to cut on some suburb services. We've tried to do that with Mr. Legault. That's what we've tried to do. But we're doing this ourselves. We are drawing a new plan, a new project to better serve the suburbs of Quebec City. That's what we're trying to do. This is not a personality issue as pertains to Mr. Legault, Mr. Bonnardel. This is about serving the Quebec population well for Quebec City. Online questions from TVA. Claudia Côté. Do you hear me well? Good day. Do you hear me? Yes, we hear you. I'd like to know, you've talked about focusing your efforts on Montreal, the Greater Montreal region for now, and people who are 85 years old and over, or even some of them living outside of that region. When can they expect a vaccination? Answer. Let's be clear here. the group comprised of people who are 85 years old and over. This is for all of Quebec. What we will do, because we wanted to prioritize things, we wanted to consider the Montreal priority, but that's for the first week, which means that when you call on Thursday, a person who's 85 or more can take an appointment from Montreal within the first week, and for the rest of Quebec, this will be the second week. So we prioritize things so that all the people who are 85 and over, that we take care of them within 2 weeks. But there will be, of course, a priority for Montreal within the first week. Next question for Mr. Legault. You said in your speech that you were more prudent in many ways. This makes me talk about the recommendations from the public health authorities, which were disclosed last week. We realized that in many ways you were more prudent than whatever the public health authorities recommended. Was it a good thing to disclose that? Haven't you made public health more fragile? Haven't you, in that sense, made Dr. Arruda's image weaker? Answer. People have asked to see the public advice. Mr. Arruda said he would be agreed to disclose the information as long as the government would agree. And I said I would be in agreement towards disclosing information. Transparency is important for me. Now, what I've seen is that before Christmas, we indeed had some public notifications coming from the public health authorities. And they suggested to open the venues, like the cinemas, the theater venues, and so on. Well, it's always easy to be the Sunday morning bleachers expert, criticizing the headquarters. Anyway, we've decided to be a little bit stricter than whatever the public health authorities recommended, because we would have thought that things would have become worse in our hospitals if we would have opened up more space for vaccination. When we talked about theater venues and cinemas and so on, there's a message here. People, before going to see a show, they meet in front of the show, maybe near the doorway and so on, or after the show. There's a gathering or a contact thing here. There's also a more political message here. The idea is to convey the message, which is be prudent because the situation is still very difficult. Question from La Presse. This is a question for Mr. Dubé, maybe. Concretely, statistically speaking, how many vaccines are we receiving this week, next week? What's the proportion of vaccines that's for Montreal? And in Montreal, those who are 70 years old or more, or 80 years old, are they going to be vaccinated before others? Answer. We'll confirm this, but it's about 100,000 per week that we receive. This will be confirmed later. But if you look at the third and fourth week, we might increase a little bit more, over 100,000. We have a little bit, something like 400,000 for the next weeks. To come back to your question, for the people who are 85 years old and over, there are about 200,000 people that were born before 1936. Question. They're not in CHSLDs? Answer. They're not in CHSLDs nor in RPAs. We think that with the 200,000 vaccines that will be delivered within the next 2 weeks, plus the 40,000 and so that we have in our reserves, we'll be able to vaccinate quickly the people who are 85 years old and over. It will give us an idea of the percentages, because it's not 100% of those people. We said that we work with 70 to 80% of people. We will start with Montreal because of the urgency. This is a recommendation of the public health authorities because the spread is happening in Montreal. Let's vaccinate people, quickly in Montreal because of the outbreak there. And if people call from Sept-Îles or Quebec, we can tell them you can make an appointment starting this Thursday, but we'll give them an appointment for the March week later. Question. There are more and more schools closing. This is concerning. There's the March break also around the corner. Are there any plans to deploy rapid tests for the schools and link with the variant? Is there there any plans for that kind of rollout? If Dr. Arruda wants to complete this, I may say a few things anyway. We've decided, as for the rest, to be extremely transparent regarding the number of variants. Where are we at right now? Well, we have a certain number of variants that were confirmed through some sequencing. We have 26 of them, some tracking, and this is added onto the potential list, which means that the positive tests that went sequenced twice, we have 486 cases like that, which means it's 69 more cases than yesterday. Things are progressing, but things are not exponentially growing. These are the right data that we have. We are at 10% right now of our positive tests, which are perceived as potential variants. This is something that's compared with Ontario, pretty much. So before opting for rapid tests, we have a line which is around 10%. We've been seeing that for the past days. What's very important, we must provide follow-up on that, and that's why we're extremely transparent vis-a-vis the public. We need to see if we're going to remain at 10% or are we going to go higher, up to 15%. Maybe we'll have more information for you within the next week, because that's what we've seen in other countries. If they can control the new variants through some sanitary measures, or maybe they had a huge exponential spike, which was extremely fast. So I would say the next week is extremely important, if not the next days. So to come back to your questions on the rapid testing, I'm repeating this. This is a complementary and additional tool. We can use rapid testing in some places, but I'm repeating this. There are variants that we cannot detect, we cannot confirm through rapid testing. We may know the ID now, for example, we may know that a test is positive, maybe through rapid testing, but if we consider the PCR and we want to have a second testing, it's not as reliable as if we had a nosocomial PCR with the same method. Anyway, we'll find the right way, especially with outbreaks in schools. Again, what we prefer when that happens is to opt for these services corridor for our screening centers that can provide us results within 24 hours, because we've improved a lot on that front. But I repeat this, places when things can be done in a complementary way, mainly in businesses, if we can do that additionally, we will do it. Question from Cogeco Nouvelles.
Est-ce que ça fonctionne, Louis?
Is this working, Louis?
On va revenir après.
We will come back later. And Mr. Patrick Belrose from the Journal du Québec newspaper.
Oui, bonjour à tous.
Question? Good day, everyone.
Oui,
Mr. Legault, I'd like to come back to the tramway file. According to Mayor Lebaume, there was an MOU that had been agreed on before Christmas regarding the tramway route. And it's as if your government would have gone against the MOU that was agreed on. I mean, why was there a change? Are you discarding it? Answer. In January, there was a greater consultation that was done, and we realized that a lot of people thought that the suburbs were not well served, not served good enough in the new project. So that's why we talked again to Mr. Lebaume, and we told him we have to make changes here regarding the tramway route as proposed. But I want to be clear here. We've always said this, and I'm repeating this. There will be a tramway in Quebec. There will be a structuring network, structuring transportation network. We just want this project to serve as best as many people from Quebec City and the suburbs as possible. Regarding the public notices, Mr. Arruda was thinking of having 75% of students back in school. Why haven't you listened to the public health authorities? Answer. I remember the discussions on that file. This was the first proposal, indeed, from the public authorities, public health authorities, but we've talked about the feasibility and also about what was the best solution regarding the students. And what I understood mainly regarding the education department people, is that this was not an ideal solution for children to have half of the children in school and half of them doing some home study. The idea was to bring them back together and to alternate days, one day off, one day on, one day in school, one day not. And Dr. Arruda and the public health authorities agreed, if I remember well, they agreed on that counter proposal. With that counter proposal, if you may say something. Yes, indeed. We're not pedagogical experts, of course, but it's always a matter of feasibility regarding these files. And people will say that if we separate students in classrooms, it's worse because the teachers then must take care of two groups and not just one group. People say that attending a classroom is much better than doing things virtually. Question from Radio-Canada. Good day. I'd like to come back to the INSPQ presentation, last week's presentation regarding the second doses. What was said is that the efficacy of the vaccine was not impacted by the delay. There had been an extension of the delay that could go over 90 days, and they said that it was up to the government to decide on that. Do I understand what you stated, that it's out of question to go beyond 90 days? Is it possible then to conduct both operations at the same time? First of all, to give it to the people that received the first dose, to give them a second doses in the CHSLDs, and at the same time do the massive inoculation campaign like the one that's happening at the Olympic Stadium? Answer: indeed, we always said that there would be a second dose. The decision is about administering the vaccine within 90 days. We'll not come back on that, and we need to provide enough vaccines in order to cover the population and do it well, and we'll do that. And when people get their first dose, they will have a second appointment for the second dose. So that's the decision that was made, and that's what we will do. Question about accountability, something that's dear to your heart, Mr. Legault, Mr. Dubé. Also, you said earlier, Mr. Dubé, that you had a super racing car ready to start, but you had no fuel. Do we understand things clearly here? If the road's not great, if there are issues now, it cannot be Ottawa's fault now, because now you have a car and you have the two hands on the steering wheel. Answer: there was a caricature about our car, whether or not it was ready or not. I think our car is working very well, but we need some fuel, to go back to that metaphor. But as I said earlier, our forecasts are based on the commitments from the federal government. About 100,000 vaccines from Pfizer. The moment we get the vaccines, we will vaccinate. We are ready, and we've shown this since December the 14th. We're always falling within 4 to 5 days. When we get the vaccines, and after delivery, we vaccinate our patients. We were promised 1.3 million doses by March 31st. If we get those doses by March, the end of March, people will be vaccinated for sure. Question from Le Soleil.
Bonjour, messieurs.
Mr. Legault, I'd like to come back to the tramway file. You've talked about consultation in January. Is that a survey? What are you talking about when you talk about consultation? Answer: we're talking about the consultation within the Council of Ministers. We're talking about a general consultation in-house, internally. Question. This is for Mr. Dubé. The second appointment was provided while you provide the second doses? I mean, isn't that dangerous in the sense that the appointments have been done? No. Answer: we want to provide some element of foreseeability. We will come up with the same principle. We'll commit to do things within 90 days. And if we can speed things up, we'll do it. If we can fast track it. But for us, it's always the same principle. It's always the same principle to vaccinate as many people as possible, to decrease the contagion, to mitigate risks for people. And when we can do this within the 90 days, when we can do this, we'll do it. But but we will be able to provide a second appointment when people get for their first vaccination, first dose. Question from Journal Métro. Good day, gentlemen. I don't want to go too further away, but you know what the objectives are as pertains to the federal government regarding vaccination for all the population in general, those that want to be vaccinated. They were referring to September. Should we understand that in Quebec also, all Quebecers that want to be vaccinated could also be vaccinated by next September? Answer. The answer is yes. As long as we get the delivery of the vaccines. We need to get the vaccines. I know I'm annoying here, but we need to get the vaccines. Now, by the end of March, I mean, if we receive things well, we're concerned a little bit about Moderna because they must be delivered during the last week of March. Anyway, as long as we get the 1.3 million doses between the 1st of April and the beginning of September, between those months, we must have vaccinated at least, we must have provided at least 12 million doses. So 75% of a proportion out of the 8.5 million Quebecers that we have to vaccinate them twice. So we're talking about 75% and then 8.5 million. The longer the period, which means that starting April the 1st, the deliveries are coming in until September. Then we have about 20 weeks to provide 12 million doses. That's our reality. And we hope to receive as many doses as possible, as quickly as possible, so that we can vaccinate all Quebecers that want to be vaccinated before the month of September. If the federal government delivers, we will also deliver vaccinations, if they deliver the goods. Thank you. And you've talked about 400,000 doses that should come from the federal government. How will you ensure that you have enough staff to administer those doses? Answer. This may be the easier question today when we get 100,000 doses per week. Well, I'd like to remind you that for influenza in the month of November, for the third and fourth week in November, we were administering 250,000 vaccines per week. So 100,000 doses per week. It's easy for us. Last fall, we had great collaboration from the pharmacists, and they did almost half of the vaccination in complement along with our public network. So for us, for the upcoming month, I would say, tongue-in-cheek here, it's almost a practice because 100,000 doses, we can do that very easily within that framework. Now, I'd like to take advantage of your question to say that currently we have like 3,200 people that are administering the doses. We might miss 1,000 workers that were ready to train for the bigger time, but when we'll need more vaccines. Some businesses will help us also. The Premier has mentioned this. We need to train an additional 1,000 staff members that will provide the vaccines. So we need 1,000 additional people by May. So everyone interested, we've opened up for the creation of new professions. If you want to help us, go onto Je Contribue and we'll train these people because we need more staff for our vaccination teams. We'll try again with Cogeco Nouvelle. Question.
Oui, bonjour. Vous m'entendez?
Good day, do you hear me?
Oui. C'est une grande victoire.
Great victory then.
It
seems that there are cases, the new variant that we see in new schools and so on. Have you thought about doing vaccination in schools because of the outbreaks in schools? Have you thought about vaccinating children in schools and also the teachers, the staff working in schools so as to avoid some outbreaks in schools? Answer. Vaccination is not recommended for children under 16 years of age on the basis of what was concluded. So the objective of vaccination is number one, to protect from complications, thus to protect the elderly, to protect mainly those that will suffer from severe impacts, eventual deaths and hospitalizations and so on, the impacts on the health system. Anyway, so We don't know also if the vaccine protects people or stops transmission. So I want to convey a message that's extremely important. We're entering an era which is extraordinary. Vaccination will provide us with the light at the end of the tunnel, but as the Premier was saying, it takes 3 weeks before we see the effects, the positive impacts. Even though if you're vaccinated, you receive your first dose, your second one, eventually, in spite of that, we'll have to keep following distancing and measures like that, sanitary measures like mask wearing. And some elderly homes have seen that people have loosened up measures. They think that the vaccine is good. Obviously, it's efficacious. It's going to prevent some complications, but it's not going to prevent transmission. So you should not lower the guard. You should continue following the guidelines and all the recommended measures from sanitary authorities. Question: will Greater Montreal region be favored for each age cohort, or is it just more for the people who are 85 years old and over? Answer: we try to adjust things in view of the epidemiological data, whatever is active in terms of numbers. So Montreal has a really hot core of contagion. That's why we want to speed things up there. But it doesn't mean that we won't vaccinate elsewhere. This will be like a balancing act, and as soon as we get some doses, there will be less and less differences between regions, but we are providing some weighing effect as per the number of cases and regarding also the number of populations which are more at risk. English questions.
Yes, hello. My question's for whoever's best suited to answer it. So I understand, as you say, 85 and over is the next cohort, but we're being told by certain CUSs that they're already starting to give vaccination appointments to people 70 and over. There's obviously specific groups of people. Maybe you can clarify first how this prioritization is going forward.
I'm not sure if I understood all. Would you mind repeating the question? It's very noisy, and I didn't get all the question, if you don't mind.
Yeah, no problem. We understand you say that 85 and over is the next cohort, but some CUSs are already giving vaccination appointments to people, anyone 70 and over. Obviously, it's under certain groups, people with who are undergoing care, have vulnerabilities. But I'd like you, if you can, to clarify how that prioritization is working.
Well, it's not a matter of prioritization. It's a matter, most of the time, that especially with Pfizer, if you recall, initially, when we were shipping those vaccines in the far region, we didn't want to lose those vaccines. So the CIS and CIUS has made the decision, instead of losing the vaccine, they went down to the second category. And we will not see that in the next few weeks, because now we're concentrating in Montreal and then after. But the objective is still, priority is 85 and over. And this is by exception that it did happen in further region.
In the same vein, what could the process be going forward in the coming cohorts for people who do have these health vulnerabilities, compromised immune systems? Will those people still have to wait for their age cohort, or will they be able, if they can prove that vulnerability, will they be able to go early? What type of system are you thinking might function going forward for those people?
They're going to be specifically invited through I would say, they will tell exactly which group, which kind of vulnerability can go before going to the general population.
Invited, though, I guess my question is invited based on what? As we understand,
there's going to be publicity. There's going to be, I would say, information given in your territories about which is the group that could be going down right now.
Okay, thank you.
We'll go with Jesse Faith from Montreal Gazette.
Good afternoon. Mr. Dubé, I was hoping I could hear you in English on the issue of people who are over 85 years old but who live alone right now, might have some mobility issues. Getting to a vaccination site could be difficult for them. What are the measures that we're thinking of in terms of reaching those people?
Yeah. That's a good question, because as you know, as I said before, we're not able to move the vaccine. That's the issue. We can with Moderna, but that's very little. and it's easier. But with Pfizer, we cannot move the vaccine. So that's the reason we went into CHSLD, we went into RPAs, and now what we're asking is, even though people are older, like 85 and older, we're asking them to come. For those who cannot, we ask them if they can be accompanied by either their proche aidant or some people that can help them, because right now we cannot move these vaccines. What we've asked each PDG of each CIS and CIUS is go through what we call the communal organization and make sure that they can help those people moving to the closest vaccination. But right now, that's the only alternative because we cannot move those vaccines.
Thank you. And Premier Legault, on a separate topic, I know you mentioned you're concerned about the variants. At the same time, you're saying if things stay as they are right now, we could be thinking of reopening things after March break. The INSPQ projections from last week showed that if the variant takes hold, we could see an increase of up to 2,000 cases a day in Montreal alone. How do those two ideas go together for you?
But first, we'll wait for the recommendation for public health. As you can see, we're going in the right direction in the number of cases, hospitalization, and even death. So what we need to see in the next few days is the impact of the March break and the impact of the variants. And what I said is, if the situation continue to go in the same direction, we can expect to reopen, for example, theaters in the next few weeks.
Thank you. We'll go with Amanda Klein from CTV.
Good afternoon. Just to follow up on my colleague's question, there are people who have emailed us, and I'm sure other journalists as well, who say they just can't move their loved one who is over 85. Based on your response, it's sort of like, well, kind of too bad in a way.
No, I wouldn't say too bad. What we're asking, and again, we're dependent on the type of vaccine that we have access to. As I mentioned, we have better flexibility with Moderna vaccine, but we haven't them right now. They are expected in the next few days, or sometimes they have been postponed. So we have more flexibility with them to move them. With regards to AstraZeneca, that will be the best example of vaccine that we could move. But right now, we don't have the vaccine that we can move. It's not a matter of saying too bad, no, on the opposite. But I'm just saying that what we're gonna ask is each PDG of CIS and CIUS, and there is one here today, we're saying, can you find a way to facilitate transportation for those people? Because right now, we cannot move those vaccines. But we hope that within the next few weeks, even though the delay for the 85 has passed, that we can have those vaccines that we can move.
Okay. And for Dr. Arruda, I'm wondering, was it a public health recommendation to open arenas, pools, and movie theaters during March break? Was that a recommendation from public health?
Yes, we did discuss what could be done with lower risk for helping families who don't have the opportunity to go elsewhere, and as there was crowding outside, I would say, in skating, we opening arenas, well controlled, with good access. Cinemas with good measures would be something we could help, I would say, for the ones who want to do sport, for the ones who want to do cultural activities, like the museums and everything like that. So it's why we did recommend that specifically in the context of the spring break. But I want to say that it's not because we are making those softening things that people must get together and have big parties. You know, we need, this virus is living when you get in contact with somebody else. Less contacts you have, less risk you have of transmission. And even the new variants will react the same way. They won't get you if you have distanciation. So it's why it's so important, if you want to go till the vaccination is going to be at high levels, to keep in that situation. And please, during spring break, don't think it's a party time at all. Just try to use outside, have do sports, things like this, but don't try to do meetings like in Christmas time when we get in trouble with this.
Thank you.
On va passer à Gloria Enriquez de Global News.
Question from Global News.
Can you hear me?
Yes. Yeah.
So with the information that you have now, by when do we project to have most of the population in the province vaccinated?
Well, I think the objective, and it's in parallel with the vaccine that we will receive from the federal government, would be to have all the Quebecers that want to be vaccinated by the end of September. That's the point. And I think if we receive the doses that we're supposed to receive and get those 2 doses, we can be able to do that by the end of September.
Perfect. And my second question is, actually a viewer submitted this. If a 75-year-old lives with an 85-year-old, can they get an appointment to be vaccinated at the same time?
Unfortunately, no. I know it's disappointing, but as you can imagine, we need to trace the line somewhere, and the date that will be the valid date for obtaining an appointment is the date that you have on your card, and that's basically the way to go. Hopefully, that 75 will be right behind that 85 as quickly as possible, but we need to trace the line somewhere.
And we have a last question from Morgan Laurie, the Canadian Press.
We don't hear the question.
Hello, can you hear me?
Yeah.
Okay, perfect. I was wondering what are your plans to ensure that the vaccine distribution is equitable? Meaning, I know that there's concerns that people from lower income neighborhoods, racialized communities, and those that are more vulnerable and maybe aren't as plugged in with internet access, how are you going to ensure that those people who need it are not bumped down the list, are given equal access?
Oh, no, I just want to make sure we're clear. What we said is we have a preference for the appointment being taken. We suggest they are being taken first when people can by internet. But at the same time, we'll have more than 700 people taking calls as of Thursday. So people will be able to do those appointments by phone if they cannot do it by internet. The reason we privilege the internet reservation is because you don't have to wait. You just go on the internet, you make your appointment, and you don't need to wait on the call. We suspect that on Thursday morning that there will be a lot of people calling that famous number. So what we're saying, please, for those who can, go through the internet, but if you can't, just phone or ask one of your loved one, un proche aidant, whoever, to call with your ID card to make sure that you can get an appointment. But it's internet and by phone calls, both.
I also meant, are you reaching out to make sure that members of different cultural communities or people in neighborhoods that have higher case counts, is there outreach to them to make sure that they're prioritized for vaccine?
Yes, we were told to be sensitive to that in the last few weeks. We've asked our communication people. There are many ways we're reaching them. It's a question, I think we published the information in more than 17 languages. We're asking all social network ad to be made. We're asking our communal organization to support and influence those people in certain area to get vaccinated when it's their turn to. So we have many ways to reach them right now.
Merci beaucoup. C'est ce qui met fin à la conférence de presse.
And this ends the press conference.